Arthritis is such an important thing for orthopedic surgery. All the patients we see around, I think 30 to 40% patient we see some sort of arthritis. And hence anything which is coming to alleviate the pain of arthritic patient is most welcome. And I will be talking today about chronic inflammatory arthritis, rheumatoid arthritis and osteoarthritis. And as we progress, we will see how this is a disease burden on the patient. We are all entering into an area of age where osteoarthritis is very common. We are all feeling the pain in the knee, not if the pain in the neck. So pain is a continuous associate, say after age of 60. What is the pathology and physiology? We will see current options and other limitations we will also see, and role of a novel anti-inflammatory agent which they have come up with, we will see. Rheumatoid arthritis is, as most of us know, most of us are very learned people, systemic disorder characterized by chronic inflammatory polyarthritis of unknown etiology. So far, we have understood many things, but still we have not been able to completely unlock the door of arthritis. So this is the right thing to say that it is of unknown etiology. Inflammatory state also involves the skin, eyes, lungs and blood vessels. It can involve anything. Sometimes a presentation is so bizarre that you cannot think that this is because of arthritis. Fluctuating clinical course and unpredictable prognosis is there, which we come across with the patients, associated with 60% increase in the risk of cardiovascular disease related death. This is very important because we forget. Normally we don't think that arthritis has anything to do with the heart, but I think Dr. Khetan will throw some light on it, that it is very important. It can cause severe cardiovascular diseases and complex and multifactorial pathogenesis. It has. Pathophysiology, I will not go into the intricate, do you have a pointer? Pathology of arthritis, you are seeing the cells, the macrophage in the middle and then the T cells and the B cells and the rheumatoid factor, and this initiates the infection or it initiates the immune system. And after which you will be seeing on the right side the articular cartilage where it is shown pannus. So that is how it grows and it eats into the tissue. So it is very important to know how it starts. And it starts because of these factors. And ultimately it becomes very complex. So it is very difficult subsequently to say that it starts with multiple factors, but then the damage done is irreversible. In rheumatoid arthritis, the damage which it does is irreversible. That we have to keep in mind. Osteoarthritis, as we know, it is an aging disorder. It has to happen, and probably I always say that is the way God calls us back. Slowly, our hairs grow gray, our teeth don't work. So I tell most of my patients that these are the outer manifestations. Something more serious is going inside, and this is in the joints. The joint fluid is not all that the same. Your cartilages are wearing off, and you are having problem. And there is interleukin and major cytokinins involved in pathogenesis of osteoarthritis, as we know now. Apart from TNF alpha and IL-1, elevated levels of IL-6, IL-17 and MMPs have also been shown to be implicated in osteoarthritis. And this is what we learned clinically, that osteoarthritis has a wide range of presentation. And earlier, when we went to developed countries, there is a lot of obesity that is causing osteoarthritis. In our country, we are catching up with the West. We are eating the junk food. We are not doing anything. We are not walking around. Our children are glued to TV and taking Coca-Cola all the time. And you find most of the children and also middle-aged people overweight. And overweight is one of the important cause of early osteoarthritic pain. So that we have to take care. Rheumatoid arthritis and osteoarthritis, TNF and alpha-1L1 are the major inflammatory cytokinins involved in the rheumatoid arthritis as well as in osteoarthritis. Release of these inflammatory cytokines is regulated by nuclear factor kappa B, NF-κB. Very fancy name. If you remember, it's good. But you should know that these are the things which start causing problem. And NF-κB, this is very important, is a transcription factor present in all cells. So this can cause havoc in the body when it starts going. Acts as a master switch. This is, I like this switch on and switch. I must appreciate your slide. So that is how the inflammation is switched on, and we are searching a way to switch it off. And we'll see how we are going to do that. Disorders due to NF-κB activation is rheumatoid arthritis. It can cause osteoarthritis. It can cause ankylosing spondylitis, psoriatic arthritis, or juvenile rheumatoid arthritis. So lot many things it can cause. Once it goes wrong, it can cause lot many other things. So this is the master switch. If we can search out some way of putting off this master switch, so we will be able to contain this inflammation. And they have tried, and I think we will see as we come across, they have tried to bring a drug which switches off this problem. How this happens, you see. Activation of NF-κB, how did this happens? Inflammatory stimuli from outside, and this you see. This is the activation, you see. Active NF-κB, now it goes inside the cell. Then activation of genes encoding inflammatory mediators, and then pro-inflammatory cytokinins are released, and inducible enzymes are released like COX-2 and INOS, etc. Release of inflammatory mediators take place. Outcome of NF-κB activation, lot many things happen, and the cell membranes are damaged. The NF-κB plays a crucial role in the inflammatory and immune response through the regulation of genes encoding pro-inflammatory cytokines and inducible enzymes. So this is the basic way of pathophysiology by which we have this rheumatoid arthritis or osteoarthritis. What is the innovative option they have brought? This is important. Nuclear factor. May I have some water? Innovative option for management of arthritis. Nuclear factor kappa B, as I have told you, is the switch. So we have to see how to put off this switch. Let us see how to do it. They have come out with a drug which is known as curcumin or diferuloylmethane. Biologically active phytochemical compound obtained from rhizomes of Curcuma longa. Possesses diverse properties, anti-inflammatory it has property, it has antioxidant property, it has anti-proliferative and anti-angiogenetic. Curcumin NF-κB inhibitor works over the switch which starts the inflammation and controls the master switch of inflammation. So this we have been trying, the scientists have been trying for long as to what is the way so that we can stop the start point or the starting of the inflammation. And this, they have very rightly said that it is the master switch of inflammation, that is NF-κB. This we have to remember. Prevents activation of NF-κB. This what does this do? Multiple sites of action. Prevents activation of NF-κB by inhibiting IKB kinase. Prevents translocation into the nucleus. And prevents the release of inflammatory mediators. So all three things it does. So obviously when it does all three things, so obviously the inflammation is lessened. And role in rheumatoid arthritis and osteoarthritis, what are the evidence? As we know that in science, this is evidence-based medicine. So unless whatever we say, if it is not backed up by evidence, we don't agree to it. So what are the evidence? We have to see that. These are the comparative studies they have done. I will not go into the details, there are too many, but primarily they have reported and that the results are very encouraging. And here I must say that the test of the pudding is in eating. So, and the test of a drug is in its use and its value in the long term. Many drugs come. We have seen many drugs coming and vanishing away in thin air. So the test of a good drug is that it stands the test of time. And that only can be done by the clinicians or we all. So I hope and wish and pray that this drug which they have come up as an innovative drug should prove to be good, hopefully. And 18 patients they have in rheumatoid arthritis were treated with curcumin for 2 weeks. Curcumin improved joint swelling, morning stiffness and walking time. Curcumin was very well tolerated with better GI tolerability. Then they have a series of 820 patients. This also showed significant improvement in pain, improved joint flexibility, better quality of life. 50% of patients were able to discontinue use of NSAIDs. Here I must caution you that this is the arthritis, osteoarthritis, rheumatoid arthritis and ankylosing spondylitis is a major concern in our country, as in other countries as well, because it lays off our limb. Most of the people are not able to perform to their normal being. So say in a year, if you are on bed for 30 days, how much loss the nation is suffering? How much loss your family is suffering? How much loss the work where you are working is suffering? So it's a huge loss to the nation. So we have to see with these things with that angle as well. So 18% treated, so this we have already have. And this is another series in which they have seen 367 patients of primary knee osteoarthritis. Incidentally, here I would like to share one more thing. As we know, in the knee osteoarthritis, the fashion of the day is TKR. TKR or total knee replacement. That is the in thing for quite some time. And in India also, we are doing many TKR. Recent reports from America, which I have gone through, and I think some of you might have seen, that in America they have a review of last 20 years of TKR. And they could find that 30% of the TKR were not to be done. They were not required. So out of our enthusiasm of doing something or laying hand on some new thing, we go on doing in a way which may harm ultimately. So to my firm belief is that we should use things which has been given by nature to the maximum until the time we are sure that they are not harm. Be it knee, be it liver, be it kidney, be it heart or brain, anything. The nature has gifted us, we should use it to the maximum until the time we are very sure that it is no more working. But sometimes out of enthusiasm, or if I am one patient was telling me that as I entered into a Delhi surgeon, orthopedic surgeon, the moment I entered, he said, okay, you are limping, you have to undergo a surgery. So that is he is sitting there with a pre-monitored mind that he has to operate. So that caution has to be taken. We have to try not to avoid surgery if possible and do it where it is needed. Then they have another 100 patients with osteoarthritis were treated with curcumin for 8 months. The results were significantly decreased. Then 88 patients. These are some of the series they have done in different patients, and all of them are very encouraging, which is good. Combination therapy is also good with this. Curcumin, when given along with celecoxib, enhances action of celecoxib on COX-2, decreases need of celecoxib. When given combination with prednisolone, provides additive anti-inflammatory action. And here a caution that prednisolone should be used with great discretion and restraint, because as you know, it doesn't put off the fire, it just keeps a lead on it. The fire is inside, the lead being on it, we feel that there is no fire. The fire is burning and it is damaging, the lead is only prednisolone. And curcumin, when administered with methotrexate, provides synergistic anti-arthritic action, may help to reduce dose of MTX, reduce risk of hepatotoxicity and hematological toxicity. Safety. Safety generally recommends were observed with dose up to 8 gram daily for 3 months. Unlike NSAIDs, free from adverse effect on kidney, liver or cardiovascular system, even after long-term use. This we have to see. This will emerge with the passage of time. More time is required for any new drug to be tested like that. An occasional patient may complain of mild and transient nausea. So here I am, and I'm very happy that we have come up with a new drug and innovative formulation of curcumin. Hope that this will lessen the pain of patients and will give them better life, hopefully. And what is the conventional limitation we have already talked through? I will not go into detail. Bioenhanced curcumin, they have made this new thing, that they have a nano-sized droplets in GI fluid, which goes directly to the blood vessel. This is a very, most of the drugs now are in nano dispensation. So this is easier to go, more quickly is go, more drug is delivered at the site where it has to work. So I think this technology definitely helps. Nano-sized hydrophilic droplets of curcumin, improved absorption obviously, and better tissue penetration. Bioenhanced, I will just skip this. And bioenhanced doses, what are the doses? The exact dose may vary from patient to patient depending upon disease severity, degree of inflammation and patient response. Obviously, we have to see what is the stage of patient, what is the nature of pain, how much he requires, and with how much drug he is comfortable. Majority of patients with mild to moderate inflammation usually respond with 100 to 200 milligram per day. If required, one can increase up to 400 milligrams safely. That is what they say. Bioenhanced inhibits the master switch of inflammation. This is what I think is the carry home, that it inhibits the master switch of inflammation, that is NFK. So this is a very good thing. And unlike biologics, can be given orally, is safe and well tolerated. It has lot many other qualities as well, as they have enumerated. Let us see. And an attractive option in management of rheumatoid arthritis and osteoarthritis, either as a monotherapy or combination therapy. Particularly useful option in following group of patients: intolerant to NSAID, steroids and DMARDs. Compromised renal function, obviously this drug is there, and hepatic dysfunction because it doesn't affect the kidney and the liver, and CV disorder, hypertension and CHF. In all these conditions, this bioenhanced curcumin can be given safely and has been proved to be good. So let us make life pain-free. This is the doctors want all the patients to be pain-free, and also the pharmaceutical company, and this is I think a great idea, and I congratulate Cadila for coming up with this new product and wish them all the very best. Thank you so much.